Today I wanted to tell you a little bit about the pros and cons of having your membranes stripped when you are late in your pregnancy around your due date. Your doctor is most likely going to ask you, do you want your membranes stripped? And what does that mean? Well, it's a traditional way of helping to stimulate or induce your labor. It's usually offered once you're at your due date or past it. And the reason why, well, what it is, let me explain that first. What happens is your bag of waters, your amniotic sac, is attached to the lining of your uterus all the way around and down by your cervix. But then when your water breaks, or when your labor starts and baby starts, the lining, the membrane that holds the sac and your cervix and uterus together is separated. So what the doctor will do is he will go up into your cervix just with their finger and stick it just past your cervix, move it around a little bit, and it strips the membrane off between your sac and your cervix just a little bit. And what that does is it stimulates the release of hormones, prostaglandins, that help start your labor. Now, it's not the only factor that will start your labor, but it helps. Now, there's good and bad about doing. The good thing is that it can work really well for a lot of ladies. They can go into labor within 12 hours, 24 hours of doing this and not have any problems. But other women, it does nothing whatsoever, because like I said, there are multiple factors going into starting your labor. But this is one of them, definitely. And the thing is, the data and statistics in research and studies show that stripping your membranes is really a 50-50 chance. It's a 50-50 chance, and it's hard to know how it's going to work for you at all. The women that it doesn't benefit often have pain. It's really uncomfortable when it happens. Some women, it doesn't bother them. You can bleed afterwards because, things are getting poked around in there, and there's a small risk that your bag of waters, your sac, can rupture from that, which can lead to an infection if you don't go into labor soon enough. And so, but like I said, it works well for some women too. And they go right into labor and have a natural labor just fine. So, if you think stripping your membranes is something that you want to talk to your doctor or midwife about, then go right ahead. I have never done it before. I've never needed to. I didn't feel that a 50-50 chance of possibly going into labor would be a big enough benefit to doing it. Because if the risk was better, like say if stripping your membranes was 75% chance likelihood of helping you induce your labor without any harmful side effects, then I probably would do it more often. But it's just one of those things where you don't have to. It might help, it might not. And so I would rather